Well, good afternoon, everyone. I am Denise Johnson, the Acting Secretary of Health and Physician General at the Pennsylvania Department of Health. I'm so glad to be here with my colleagues, especially Hershey Pharmacy. They've been partners of ours, especially over the past couple of years. Thank you to the Pennsylvania Pharmacists Association and the Pennsylvania Department of Drug and Alcohol Programs, our state partner during this opioid epidemic. And thank you to all of you who are participating because you understand the importance of the measures that we need to take to combat this opioid epidemic. So all of us, either individually or through a friend or family member, have been touched by this opioid epidemic, and we are still in it right now. We need to use all the tools in our toolbox to make sure that we save lives and help people recognize treatment and recovery. I'm here today to talk about the expansion of the standing orders to include additional forms of naloxone. Naloxone is a life-saving antidote that can help save an individual who is experiencing an opioid overdose. And so I am encouraging all Pennsylvanians to carry naloxone with you because you might have the opportunity to save the life of someone, again, who is experiencing an opioid overdose. We've expanded recently the standing orders to include additional forms of naloxone, including more cost-effective, non-pre-filled vials with syringes so that individuals can have more options for naloxone that they may carry. So right now, there are 4 forms of naloxone available through the standing order. So in addition to the naloxone nasal spray, there is a higher dose naloxone nasal spray, as well as the non-pre-filled syringes that I mentioned, and also an injectable naloxone as well. We want to make sure that naloxone is available in as many forms and dosages possible so that individuals can have a choice of what they carry, what they're comfortable with in order to save a life. We also have updated our training materials. So on the Train PA site, you can get more information about how to use the various forms of naloxone. Thank all of you and thank all of our partners here for your work addressing the opioid overdose. We want to make sure that individuals know that they can get, pharmacists now in Pennsylvania are able to prescribe or dispense naloxone without an individual prescription. So you could get a prescription off of the website, you could get it from your doctor, but naloxone is available without an individual prescription. So thank you all for your partnership. Thank our pharmacists and pharmacies for having naloxone available for individuals so that they may be able to save a life experiencing an overdose. So now it's my pleasure to introduce the assistant to the Secretary for Department of Drug and Alcohol Programs, Steve Ross. Thank you.
Thank you, Dr. Johnson. Good afternoon. I'm Steve Ross with the Pennsylvania Department of Drug and Alcohol Programs. I'd like to start off by thanking the folks here at Hershey Pharmacy for having us here today and for being a partner in making naloxone available to our fellow Pennsylvanians. Thank you. The importance of carrying naloxone, the overdose reversal drug, and how to reach every one of us can access it cannot be overstated enough. Accessing naloxone is step 1 in helping to save a life. Across the Commonwealth, local and state partners in the drug and alcohol field are working each day to keep Pennsylvanians alive and decrease the chances of folks suffering from a fatal overdose. These efforts have been amplified coming off a near-record year of fatal overdoses in both 2020 and 2021. Compiled with the rising prevalence of fentanyl, I assure you expanding access to naloxone continues to be a top priority of the Wolf administration. As I mentioned a moment ago, at the state level, DDAP and our partner agency and partner pharmacy standing with us today are committed to continuing the fight to ensure all Pennsylvanians have access to necessary life-saving resources like naloxone. As a whole, we know that in order to reduce the human and economic impact of the disease of addiction, we must confront the devastating effects of stigma. One way to combat that stigma is to normalize the carrying of naloxone and make it feel as normal as picking up your prescription. Naloxone is a medication that saves lives. There's no disputing that fact. The harsh reality is that none of us know when and where we might come across an overdose, someone experiencing an overdose. It could happen anywhere, anytime. Naloxone serves one purpose and one purpose only, to save lives. And the more Pennsylvanians have access to it in their homes, their glove compartments, their backpacks, the more we can normalize the accessibility of naloxone and then demonstrate the desire to help our fellow Pennsylvanians who are struggling with substance use disorder. If you are listening and wondering how you might be able to get naloxone, please go to our website at ddap.pa.gov and click on the link Get Naloxone. There you can find the variety of different ways that you can access it. With these resources, all residents of Pennsylvania who are at risk of experiencing an opioid-related overdose, who are family members or friends who are in a position to help someone at risk, can now get naloxone, no matter what. Please take advantage of whatever method you choose to get naloxone, and please carry it with you. I'd now like to introduce Chuck Cray, the owner and pharmacist here at Hershey Pharmacy, who will speak on the availability of getting naloxone here.
Thank you, Steve. As Steve has said, we've had a growing opioid overdose problem. Introduction of fentanyl has changed the dynamic. It's raised the stakes dramatically. Incredibly small amounts in micrograms. And just to put that in perspective, a microgram is 1,000th of a milligram is 1,000th of a gram. This is 1 gram in that packet. So 1/1,000,000th of that is the dosage that we're dealing with fentanyl. So it doesn't take much to get 50 or 100 micrograms, which if somebody's already using an opioid, could be fatal. So it's something that people need to think about. That's part of why we're seeing the increase in deaths. Nationally, almost 3,000 deaths daily. In Pennsylvania, about 15 a day. Naloxone can be the difference between someone we know living or dying. All of us know someone affected by the opioid epidemic. Friend, family, opioids affect us all, and it's across every socioeconomic class. There's no difference. I have a nephew, bright young man, who's fought this fight for about 20 plus years. I am proud to say that he is now fully clean, productive, engaged to be married, and moving forward in his life. Naloxone saved his life on multiple occasions. That's what it does. It gives people a second chance. Naloxone can also be used for patients who have prescriptions for opioid pain medications. It's not just for illicit drug use. We're starting to see that in many of our facilities that we serve, where if somebody gets an order for a narcotic, for an opioid, they're writing an order for naloxone also for safety. Naloxone is not a drug which someone can become dependent upon. If someone not suffering for an opioid overdose were given naloxone, there would be no effect on them. It works by binding to the opioid sites in our body, essentially kicking the opioid off those sites and reversing the opioid overdose reaction. That's it. It's that simple. It's kind of like a fire extinguisher for overdose. Where naloxone is extremely prevalent, it's shown to reduce hospitalizations by up to over 60%, which is significant. Naloxone is available as an injection, as Dr. Johnson has shared. It's also available as the nasal spray. There's also a 4 milligram and an 8 milligram now, more and more options. For the most part, in community pharmacy, we see the nasal spray for the ease of use. It is very easy to use. There's no prescription required to get it. Anyone can carry it. You do not have to be the person that may end up needing it. It may be someone you know, someone you love, someone you're related to. It's dispensed under the Physician General Standing Order, the same as the COVID shot, which again, we should all consider. The simple reality is that your community pharmacy is the easiest access point for obtaining naloxone to potentially save a life. It's far easier than you think. Stop in and ask your pharmacist how you can possibly help to save someone's life by obtaining, carrying, and knowing how to use naloxone. I'd now like to introduce Victoria Elliott. Vicki is our CEO of the Pennsylvania Pharmacists Association.
Good afternoon. Thank you, Chuck, a past president of our association. Thank you, Acting Secretary, Physician General Dr. Johnson, and Special Assistant Steve Ross for inviting me to join you today, along with my colleague, Chuck. As we have made keenly aware, during the pandemic, pharmacists play an important role in the healthcare system. From administering life-saving vaccinations and dispensing critical pharmaceuticals, they remain the most accessible healthcare provider in our communities. Studies have proven that naloxone is to be safe and effective, as we've heard today. In the past 4 years, more than 77,000 doses have been dispensed. That's 77,000 lives that were saved. Evidence clearly shows in communities with widespread naloxone access, as Chuck stated, emergency room visits secondary to opioids have decreased over 60%. Furthermore, there's no evidence that widespread naloxone access leads to increased illicit drug use, as we've also heard. In addition, naloxone has led to increased cost savings over time and increased chances that a person's coworker, friend, or family member remains alive. It's important to note that naloxone is not only for those who have a substance abuse disorder, but recommended by the FDA to be given to anyone who's picking up an opioid prescription. As Chuck noted, I'm using the same analogy. Having naloxone on hand is like having a fire extinguisher in your kitchen. The intent is to never to actually have to use it, but should an accident occur, you're quite thankful that you have it. Substance use disorder is a violent cycle and an endless battle of strength of will for those individually struggling with addiction, their families, and friends. Pharmacists witness customers struggling decisions every day with a decision to secure Narcan. In the same way, their diabetic patients might be struggling to just eat healthy. No one would think twice about a diabetic asking for glucose tablets or diet counseling, and it should be the same for those struggling with substance use disorder. The Naloxone Standing Orders help to create a safe space for a conversation with patients and caregivers about the need and benefit of having this life-saving device on hand. Pharmacists and others with access to naloxone should be asking all their at-risk patients or caregivers if they have a need for naloxone in the event of an emergency. Experience has shown that someone who has had to use these devices often returns to that same location, typically a pharmacy, almost immediately asking for a second or third dose just to have on hand in the event of an emergency. Pharmacists across Pennsylvania are appreciative that the Wolf administration and the Pennsylvania Department of Health has issued and continues to approve this standing order as we have new dosing and dosage forms available. Based upon its success, we call upon the legislature to make this order a permanent act in order to save lives. This is not a political matter. This is a healthcare crisis issue. We also believe that there will be sufficiently more use of the standing order if pharmacists were not losing money. So we do ask that if insurers are not in a position to pay, they reconsider that position immediately and make sure that every dose of naloxone dispensed is appropriately reimbursed. Again, thank you for your time. Appreciate the opportunity.
Thank you so much. We are happy to take any questions that you might have.
As far as the cost, cost goes, if someone walks into a pharmacy and asks for a dose, does that person pay for it? Where's the money come from? How's it get paid for?
Thank you.
For the most part, the insurances are paying for the naloxone. So the cost might be $75, $80 for a dose of the naloxone, the 0.4. I think I looked up the newer one, the or the 8, and that one was probably around $125. But there's some instances where they may not pay. And that's what we're really wanting to see, is that it be mandated that they pay to eliminate the chance of somebody dying because we don't have a $75 medication available.
So to be clear, if I walked up to the pharmacy after this press conference and said I would like a dose of naloxone, you would ask for my insurance card, my insurance company would either pay or not pay, and then if they don't pay, then you send me a bill, or?
That is correct. Normally we would charge for it if it was not covered by the insurance.
And as far as the demonstration with the packet was very interesting, but as far as if someone is taking fentanyl, will naloxone reverse the fentanyl? how does that work?
Where people are getting into trouble is the fentanyl is laced through a lot of the drugs. And it's an easy way of drug dealers getting people addicted. And so they don't know what they're getting. They're assuming they're getting their usual dose of X, which opioid patients tend to become tolerant to it. But all of a sudden they've got X plus the fentanyl, and you get a 1 + 1 = 10 reaction. And so that's where the naloxone is going to come in to save that life. But yes, it will help restore that breathing. And with any naloxone type product, you may have to use it more than once. You may have to use the nasal spray, wait 2 or 3 minutes, and give an additional dose until medical help arrives.
I think it's important to note that for folks who have trouble accessing naloxone through the pharmacy because of a cost structure, please, again, go to our website at www.ddap.pa.gov. There are methods on there where anyone can access naloxone for free. So whether you're insured, whether you're uninsured, whether you're underinsured, there should be no problem in people getting naloxone and getting access to it.
And if you carry naloxone, as you've all recommended, is there an expiration date on it? Should it be used by a certain?
See exactly what it is on this one.
I stumped you.
Yeah, I didn't know it all.
There is an expiration date on it,
April
yes.
25, so it's good for about 2.5 years.
Okay.
Now, do not recommend carrying it in your glove box, though.
Yes.
I don't want the heat and the cold to do that. Keep that in your purse or on your person.
I'll get you to hold up the packet again for just a second, if it's handy. No, the little bag, just like 10 seconds of that, if you don't mind.
That is 1 gram, and we're talking 1/1,000,000th of that is what we're measuring fentanyl in.
So 1/1,000,000th of what is in that bag is enough to cause a person.
That's where you start, maybe 50 or so, but again, it's that additive effect.
And we're all here today because we want everyone to carry naloxone, everyone who has the ability to save a life to carry naloxone. And so you've heard there are lots of different forms and different ways to get it, insurance or not insurance. We want to make sure that individuals carry it. And yes, I do have naloxone in my purse. Anytime you find me, you'll find some in my purse.
Sometimes, people who encounter somebody who might be experiencing an overdose, there is sometimes this sort of issue of like, am I afraid of touching them because some people believe it can be like transferred. Can you just address that?
Again, if they're suffering from an overdose, again, where you would hear this would be like a fentanyl in a topical form where it can be absorbed. But for the most part, most of these people are ingesting or injecting some of those drugs. So I don't think you're going to have a real high probability of getting it through touch. I also do CPR, and I carry gloves in my car and stuff, so that if I'm ever upon someone, if you've got the PPE, use it. But it's not a high risk.
To an untrained person who's encountering a medical emergency, perhaps for the first time, are there certain signs of a drug overdose that would be obvious as opposed to maybe a heart attack or a stroke or some other kind of medical emergency?
Well, sometimes it can be difficult to tell, but certainly if someone is unresponsive or you want to approach them and see if they will respond from shaking and touching them, if they really are not breathing, you want to make sure that you implement life-saving measures, CPR, as you would do for anyone you encounter, because you can't know absolutely if they're suffering from an overdose. But like you've heard, naloxone is going to help to reverse an overdose, and it won't hurt the person. So you can give them naloxone, and if naloxone does not help, you can give other doses of naloxone, but also do the other measures. On the Train PA site, there are really great information about recognizing an overdose and what to do and how to use the various forms of naloxone. Well, great. Thank you all again for participating, and remember, you can save a life. Thank you.
Strength or the one is called Adjuvenated, which allows it to work a little bit more effectively for seniors.
Just another minute here.
And also an injectable naloxone as well. We want to make sure that naloxone is available in as many forms and dosages possible so that individuals can have a choice of what they carry, what they're comfortable with.
I sensed someone looking at me while I was up there, and I looked behind me. There's a little dog in the car that could line me up. I feel like someone's